Uterine fibroids, the silent enemy that can destroy your health. Uterine fibroids are a condition that haunts many women, often without them even knowing. If left untreated, they can cause serious health issues, leading to complications ranging from intense pain to severe fertility problems. But what exactly are uterine fibroids? What causes them? What are the symptoms? And how can they be treated before they turn into a real nightmare? Find out everything in this video. What are uterine fibroids? Uterine fibroids, also known as fibromas or leiomyomas, are benign tumors that develop in the uterus. Although the word tumor sounds alarming, it's important to note that fibroids are not cancerous. They form due to the abnormal growth of smooth muscle cells in the uterus and can vary in size, ranging from small nodules to larger masses that can distort the shape of the uterus. What causes uterine fibroids? The exact cause of fibroid development is still unclear, but it is believed that hormonal, genetic, and environmental factors play a significant role. Estrogen and progesterone, the hormones that regulate the menstrual cycle, seem to stimulate fibroid growth, which is why they tend to appear during reproductive years and shrink after menopause. Risk factors include family history of fibroids, early onset of menstruation, menarche, never having given birth, obesity, a diet high in red meat and low in vegetables. Symptoms of uterine fibroids. Many women with uterine fibroids experience no symptoms, especially when the tumors are small. However, depending on their size, location, and number, symptoms can be intense and debilitating. The most common symptoms include heavy and prolonged menstruation, excessive and prolonged menstrual bleeding, often leading to anemia, pelvic pain, a feeling of pressure or heaviness in the pelvic area, along with intense cramps, abdominal bloating. Large fibroids can make the abdomen appear swollen, similar to pregnancy. Frequent urination. Fibroids pressing on the bladder can cause a constant need to urinate. Pain during intercourse. Some women report severe pain during sex due to the pressure of the fibroids. Fertility issues and pregnancy complications. In severe cases, fibroids can interfere with fertility or cause complications like miscarriages. The dangers of untreated uterine fibroids. Ignoring the symptoms of uterine fibroids or failing to seek treatment can result in several complications. Some of the main consequences include severe anemia. Due to excessive menstrual bleeding, many women may develop anemia, causing fatigue, weakness, and dizziness. Infertility. Large or poorly positioned fibroids can block the fallopian tubes or distort the uterus, making pregnancy difficult. Pregnancy complications. Pregnant women with fibroids may face a higher risk of miscarriage, preterm labor, or the need for a cesarean section. Chronic pain. Large fibroids can press against nearby organs, such as the bladder and rectum, causing chronic pain and discomfort. Diagnosing uterine fibroids. Early diagnosis is crucial to prevent fibroids from causing further complications. Several methods are used to detect uterine fibroids, the most common being pelvic ultrasound, the most common exam, which uses sound waves to create images of the uterus and identify fibroids. Magnetic resonance imaging, MRI, used to provide more detailed images, especially in cases of large or multiple fibroids. Hysteroscopy. A small device with a camera is inserted into the uterus to visually examine the interior, useful for identifying submucosal fibroids. Laparoscopy. A small incision is made in the abdomen to insert a camera and directly examine the uterine cavity. Hysterosalpingography. An X-ray of the fallopian tubes and uterus after the injection of a special dye, used to identify fibroids affecting fertility. Treatments and medications for uterine fibroids. The treatment for uterine fibroids depends on the severity of symptoms, the woman's age, and her desire to have children. There are several approaches, ranging from medication to surgery. Hormonal medications. These can help shrink fibroids by controlling estrogen and progesterone levels. Examples include GnRH agonists, which induce a temporary menopause, and hormonal contraceptives. Progesterone-releasing intrauterine device, IUD. This can help reduce heavy bleeding, although it does not shrink fibroids. Anti-inflammatory drugs and iron supplements to relieve pain and treat anemia caused by heavy bleeding. In more severe cases, surgical treatments may be recommended. Myomectomy, surgical removal of fibroids, Preserving the uterus. It is recommended for women who wish to have children. Hysterectomy, total removal of the uterus, recommended in severe cases or for women who no longer wish to have children. Uterine artery embolization, a minimally invasive procedure that cuts off the blood supply to the fibroids, causing them to shrink. Conclusion. Although uterine fibroids are benign tumors, they can lead to serious health consequences if left untreated. The good news is that with early diagnosis and proper treatment, it is possible to manage and even eliminate symptoms, preserving a woman's quality of life. Therefore, pay attention to your body's signals and consult a gynecologist regularly to keep your health in check.